A very good evening to all of you. Let us begin with the first MCQ in cardiology. Why cardiology is important? A good chunk of questions come from cardiology CVS part in various subjects including pathology, medicine, pharmacology, even pediatrics, congenital heart disease part. So that's why mastering these topics and MCQs is an essential part to get a good score in your NEET PG. Let us begin with the first question. Adverse events associated with the use of digoxin immune FAB include. See every word I utter, you can make notes or you can rewind and see the video again and again so that you master these things. Every word I utter is an MCQ. So that potential MCQ, you have to catch it and it will be very beneficial for you. So let's begin with the first question. Adverse event associated with digoxin immune FAB. A. Heart failure. B. Hypokalemia. C. Hypersensitivity to ovine FAB epitopes. D. All of the above. Now let us know what in fact is digoxin immune FAB. Digoxin immune FAB or digoxin specific antibody. Why it is given? It is an antidote for overdose of digoxin. It is made from the immunoglobulin fragments from sheep that have already been immunized with a digoxin derivative, which is digoxin indicarboxymethoxyamine (DDMA). The sheep have been injected with this, and the antibodies so formed are used in the treatment, which are digoxin immune FAB. So, what are the side effects of digoxin immune FAB? See, any foreign protein can cause allergic reactions. So there can be hives, there can be difficulty in breathing, there can be swelling of lips, tongues, face or throat, itching, skin redness, wheezing, cough and lightheadedness. Now, contraindication. Avoid the use of digoxin immune FAB in hypokalemia, as this drug, while reversing the effect of digitalis, will further reduce the serum potassium level. So hypokalemia is one of the side effect, and don't use it in hypokalemia. If you use in hypokalemia, it can precipitate dangerous and it can cause cardiac arrhythmias and cardiac arrest. The patient must be closely monitored for anaphylactic shock. And anyone allergic to sheep protein, papain, bromelain, papaya extract should not use ovine digoxin immune FAB because it is relatively new. No drug interaction studies have been performed yet. Pharmacology, it works by binding to digoxin, rendering it unable to bind to its action site on target cells. So complexes are formed. These complexes accumulate in blood and are expelled by the kidney. So the correct answer here is heart failure, hypokalemia, hypersensitivity to ovine FAB epitopes, D, all of the above. So let's move to the next question. Vortex keratopathy is an ocular side effect of which of the following? A. Amiodarone, B. Corticosteroid, C. Chloroquine, D. Acetazolamide. Now, vortex keratopathy means innocuous corneal deposits. Now, this amiodarone is an antiarrhythmic medication used to treat and prevent a number of types of cardiac dysrhythmias. They include ventricular tachycardia, ventricular fibrillation, wide complex tachycardia, atrial fibrillation, and paroxysmal supraventricular tachycardia. The serious side effects include lung toxicity such as interstitial pneumonitis, liver problems, heart arrhythmias, vision problems, thyroid problems, and death. If taken during pregnancy or breastfeeding, it can cause problems in the fetus or the infant. It is a class 3 antiarrhythmic medication. The contraindication of amiodarone include hypersensitivity to amiodarone or any of its components, severe hepatic impairment, sinus node dysfunction including sinus bradycardia or sinoatrial block, since amiodarone can cause significant bradycardia and sinus nodal arrest. So the correct answer here is A. Amiodarone. Prevalence of supraventricular tachycardia is about A. 2.25 per thousand, B 5 per thousand, C 10 per thousand, D 20 per thousand. It is 2.25 per thousand. Selexipag best relates to A. Prostaglandin I2 receptor, B. Endothelin 1 receptor, C. Beta 2 receptor, D. Adenosine A1 receptor. Now, what is Selexipag? Selexipag is an oral non-prostanoid diphenylpyrazine derivative selected IP prostacyclin receptor agonist that binds the prostaglandin I2 receptor. Selexipag and its active metabolite Act 333679 are agonists of prostacyclin receptor which lead to vasodilatation in pulmonary circulation. It is taken by mouth or administered intravenously. The common side effects include headache and jaw pain. An increased risk of hyperthyroidism has also been noticed in people taking Selexipag. The liver enzymes CYP2C8 and to a lesser extent CYP34A4 hydroxylate and de-alkylate the active substance, thereby inactivating it. Besides, Act 333679 is glucuronized by the enzyme UGT1A3 and UGT2B7. The terminal half-life of Selexipag, which can be asked, is zero point 0.8 to 2.5 hours and that of active metabolite is 6.2 to 13.5 hours. So the correct answer here is A, prostaglandin I2 receptor. Riociguate increases the production of A, prostacyclin, nitric oxide, C, endothelin, D, all of the above. This riociguate is sold under the brand name Adempas is a medication by Bayer that is a stimulator of soluble guanylate cyclase (sGC). It is used to treat the two forms of pulmonary hypertension, that is chronic thromboembolic pulmonary hypertension and pulmonary arterial hypertension. Riociguat constitutes the first drug of the class of sGC stimulator. The drug has a half-life of 12 hours and will decrease dyspnea associated with pulmonary arterial hypertension. So the correct answer here is D, all of them. CREST syndrome includes all: A. Calcinosis, B. Raynaud's phenomenon, C. Sclerodactyly, D. Thrombosis. The CREST syndrome includes calcinosis, Raynaud's phenomenon, esophageal involvement, sclerodactyly, and telangiectasia, not thrombosis. The correct answer here is D. Thrombosis. Please click the link in the description box to join the ultimate 2-day Neet PG Breakthrough Blueprint Masterclass to be held on next Thursday and Friday. You will be notified in the WhatsApp group about the timings and the date. So please click the link in the description box. And this class is absolutely free for the first 10 people who will click the link in the description box. The seats are limited, so please click the link in the description box and please uh, subscribe this channel so that you get the notification whenever I come live. Since the exam is approaching near, I will be coming live regularly and I have been coming live on this YouTube channel regularly. So you can give your valuable inputs in the description in the comment section. You can also click the right answer in the comment section and that will be highly beneficial. Which of the following is characteristic pattern of Phlebertesia corona? A. Crown shape, B. Fan shaped, C. Teardrop shape, D. Dome shape. It is fan shape. The Klippel-Trenaunay syndrome is characterized by A. Vascular nevus, B. varicose vein, C. Soft tissue and bony hypertrophy of limb, D. All of the above. Now, what happens in Klippel-Trenaunay syndrome? It has a triad of vascular nevus, varicose vein, and soft tissue and bony hypertrophy of limb. The venous stasis in vascular malformation of lower limb increases the chances of thrombus formation and pulmonary thromboembolism. So, correct answer is D. All of them. Lewis-Dietz syndrome (LDS syndrome) is characterized by all: aortic aneurysm, hearing loss, cleft palate, hypertelorism, except hearing loss. Lewis-Dietz syndrome is characterized by aortic aneurysm, cleft palate, hypertelorism. It is related to Marfan syndrome. Correct answer here is B. Hearing. Which of the following is a dabigatran antibody? Mepolizumab, Reslizumab, Idarizumab, Benralizumab. The dabigatran antibody idarucizumab is an effective and rapidly acting antidote to dabigatran. So correct answer is idarucizumab. Warfarin used during pregnancy can cause a central nervous system abnormality, pregnancy loss, fetal anticoagulation. Yes, of course, all of the above. Warfarin is contraindicated in pregnancy as it crosses the placenta and is associated with embryopathy, central nervous system abnormalities, pregnancy loss, and fetal anticoagulation with positive. Warfarin can be administered safely during which trimester of pregnancy? A. Second trimester. B. Postpartum period. C. Breastfeeding. D. All of them. Warfarin is safe during second trimester, postpartum, and breastfeeding period. All of them. Which of the following procedure is used for correction of TGA? A. Mustard procedure. B. Sending procedure. C. Rastelli procedure. D. All of them. It is all of them. May Turner syndrome best relates to A. Right iliofemoral deep venous thrombosis, left iliofemoral deep venous thrombosis. C. Bilateral iliofemoral deep venous thrombosis. D. Any of them. It is left iliofemoral deep venous thrombosis. Factor 5 Leiden best relates to which of the following? G16169-1A, G1691B, G1691C, G1691D. It is G1691A. Factor 5 Leiden is a single point mutation. It is G1691A. To prevent hypertensive crisis, patients take MAO inhibitor must avoid A. Phenylalanine diet, B. Tryptophan diet, C. Tyramine diet, D. All of the above. It is Tyramine diet. It has to be. Pseudo-resistance refers to high office blood pressure and lower home blood pressures. C. Which of the following clinical trial evaluate eplerenone? Eplerenone is evaluated by FSS trial. Eplerenone post-acute myocardial infarction, heart failure, efficacy and survival study. That is FSS trial. Eplerenone post-acute myocardial infarction, heart failure, efficiency and survival study. FSS. Which of the following is a direct renin inhibitor? A. Guanfacine, B. Doxazosin, C. Aliskiren, D. It is Aliskiren. DASH trial stands for. The correct answer is dietary approaches to stop hypertension. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint.